Hi, today is December 19th, 2011. My name is Megan, and I will be having a jaw surgery tomorrow. I am going to be having a mandibular something osteotomy, BSSO, bilateral. I don't know. I'm having my lower jaw separated on both sides, moved back and to the right this way. This side of my jaw is longer than the other one, mandibular hyperplasia. So I am having that done tomorrow. I go in at 11 and my surgery is at 1 o'clock. He said it should only take about an hour and a half or so. At first, I was planning on having, we talked about doing genioplasty to then, once my jaws moved back, to move my chin back to where it was, but we have since decided that unless it really needs to be done, it's not going to be done. He says that I probably won't even need to have it moved once the jaws move back. But if that has to happen, it'll probably take another half an hour or so to do that. So I probably should be done by like 2:30 or 3. I most likely will be staying the night in the hospital, and then probably will spend the next day in the hospital just because my parents have to work and I need to ride home. And my surgery is taking place 20 minutes away from where I live. So, yeah, they'll have to come get me after they get off work, so who knows what I'll be doing all day. I'm hoping that I sleep the entire time so that I'm not bored out of my mind in the hospital. And, it'll also be nice to have a full day of, help with everything and getting used to how I eat or trying to speak at all or whatever. Just learn my schedule as far as my pain meds are concerned and stuff like that. I guess I've always kind of known that I was going to need this surgery. I had braces when I was in 4th grade for about 3 years. So 4th through 7th grade, I had braces. Straighten my teeth. I didn't have that much to straighten, but they were trying to fix my crossbite in the braces, and I ended up after 3 years end to end, and they kind of were like, well, let's just get them off you because, well, we can't really do anything else about it. So I kind of knew that it wasn't going to be fixed with just the orthodontics. So it's finally now I'm able to, I have the time and the situation that I'm in. I'm able to get this taken care of, and it's just a good time to do it because I'm in school. I have a winter break. I'm living with my parents, so I can afford to pay for it myself, which is nice, I guess, because then I don't have, I just, whatever. And I'm just really excited. People don't understand. They're like, I don't understand how you aren't scared. And I'm just like, because nothing's going to happen. I mean, I'm really optimistic about it, and I'm not really worried at all about anything bad happening, because if it does, when things like that occur, it's usually really rare, and I don't know, I'm just trying to be really optimistic, and I'm more excited than anything just to have this finally be done, and I can't wait to actually put my teeth together and have them bite together and fit. It's so weird. It's just so weird. People don't have any idea what it's like to not have, unless you do have a bite that's off, they don't know. It's just, yes, okay, you get used to your malocclusion, that's just how you live your life, and it's just every day, and you don't think about it, it's comfortable because that's what you're used to, but it's still not right, and it's just, you just know that it isn't, and I just can't wait to have it be the way it needs to be. I guess the only thing that I'm kind of bummed about is my maxillary midline is, the doctor says that, my surgeon says that it's only, see, it's right there, okay, and my facial midline is here, but my maxillary midline's he says it's only 1 millimeter off, and he says that every day, people and just in conversation, usually takes at least a 2 millimeter discrepancy before people notice it. Well, to me, I notice it. I think it looks like it's more than one. I don't know why he would tell me something that wasn't true. So I'm just gonna, okay, it's 1 millimeter. I think it looks like more than that. I should probably measure. I should measure it myself. But he says it's not enough of an issue. He's like, even if you wanted me to move it, to do the upper jaw surgery just to move it for a millimeter, he's like, I probably wouldn't do it. So I'm not gonna have that part done. So my lower jaw is going to be like moved over to meet my maxillary midline. So at the end of the day, my entire midline is going to be 1 millimeter off of my facial midline. And he's just like, I'm going to school for dental hygiene. And he's like, you're going to be one of those anal dental hygienists that's going to know it, and it's probably going to bug you. But he's like, just know that no one notices it. Unless you point it out, they're not going to notice it. And my mom says the same thing. She's like, nobody sees it but you. It's like, it's fine. So anyway, that's the only thing that I'm kind of like, oh, that's too bad, because then you go through all this trouble, this money, this time, and whatever, to not have it like exactly perfect kind of sucks. But I completely understand. Like, I don't really want to have the upper jaw surgery. It's it's so invasive. Like, they have to, it messes up your like sinuses. It can, there's just to imagine having like this part of my face like disconnected from the rest of my head is so gross to me. Like the lower jaw, it doesn't bug me as much, but having the upper jaw just like creeps me out. So I am glad I'm not having it done, but at the same time, I would love to have my midline shifted to the left 1 millimeter. It would be amazing. And I don't know why my orthodontics I don't know if they just, because it's such a small difference, like if they just decided not to mess with it or what. I guess it's kind of something I should have asked my orthodontist about, or I don't know if maybe they can fix it post surgery with the final like movements and stuff. Well, I don't know, I'll have to ask. So yeah, I am really looking forward to tomorrow. I can't wait to be done. I can't wait to like go under and like literally 2 seconds later wake up and think that like, oh, they haven't even started, because that's how it feels. And I'm not excited about the swelling, but I'm like really curious to see how I look. Like, it's gonna be gross. But my lips are already really big, so to imagine them being any bigger is like hilarious to me. So yeah, so tomorrow I'll just have to see how it goes. And I don't know, that's it, I guess. Anyway, okay, so I will do some profile. I'll do my like facial views to compare. Okay, so this is my facial. Mouth closed. Smiling. You can see my teeth. They look really yellow right now. Okay, so it's them. And I'll do a side. And my other side. Okay, so, all right, well, if I decide to do another video, which I don't know why I would do this one and not finish doing more, but, well, I'll see you after. Thanks.